4 minutes after 7 o'clock. Well, the National Family Planning Board, in association with CARICOM and the Pan-Caribbean Partnership Against HIV and AIDS, PANCAP, has launched a public education campaign called Champions for Change. PANCAP is a Caribbean regional partnership of governments, regional civil society organizations, institutions, bilateral and multilateral agencies, and contributing donor partners.
The campaign is to build awareness and promote basic human rights with a focus on the right to non-discrimination. Funding from the Global Fund to fight HIV and AIDS, tuberculosis and malaria will facilitate the campaign, which will support other interventions geared at reducing HIV-related stigma and discrimination and also human rights violations against persons living with HIV and AIDS and their families. The National Family Planning Board recently engaged several prominent champions for change to aid the campaign. 3 of them joins us now. Good afternoon. Good evening
now. Former political ombudsman and attorney at law, Donna Parchment Brown. She has served as an advocate, mediator, and arbitrator for safe conduct of Jamaica's elections. We also have Demario McDowell, an Excelsiorian, is a versatile artist who is a singer, graphic artist, and philanthropist, as well as Demario Guthrie, a medical doctor, as well as a reggae soul singer, songwriter, podcaster, and TV host. What a long list.
It's a very diverse panel.
Good evening, Champions for Change.
Good evening, all.
Good evening, Cliff.
Good evening.
Excelsiorian.
Yes. Donna, are you there?
I'm here and in great company.
Yes, you are. Tell me about this new assignment you have now as a champion for change.
Thank you so much, Cliff, and for the opportunity for us to talk with our fellow Jamaicans about what is a very difficult issue. Jamaicans who suffer from stigma, discrimination, and do not get the human rights protection that the Constitution affords. And we think it's important to lend our voices and our brands to this effort by the National Family Planning Board. You know, if we have a medical condition, we must be treated like everyone else. And I think that's the bottom line.
Mm-hmm. And for you, Demario, what's your role in all of this now? As an artist, singer, yes?
Event producer et al. Well,
Yes.
I tell you, all of my audiences are going to be engaged in this whole process of reducing stigma and discrimination against HIV positive, how can I put it now, victims. Because one of the thing about it too is that students in schools find themselves sometimes stigmatized. Mm-hmm. The parents sometimes stigmatized when, if for whatever reason a disclosure is made. A teacher may even be stigmatized. And this is an unhealthy way in which to live, because the whole thing of mental health right now, where people are just on an edge, just on an edge because of what is happening in the world economically and so on. So socially, for another vacuum to be created is not an easy place, is not a good place to be. So we are lending our voices to try and make a change for the better for some of these our brothers and sisters.
Mm-hmm. So, Dr. Guthrie, tell me now.
Yes, Cliff. I'm honored to have the
that is Saeed
on board, but I
make
get
you
a
good?
unique opportunity to be a medical professional and see this from the angle of a healthcare worker. So I have patients who are living with HIV, and I get to hear about their experiences of discrimination and stigma on a regular basis. So I am happy to be on board, because I have both creative audience and a medical audience, and I feel like I can definitely reach out and help to impact this cause, which is very important, been going on for a long while, but we always have to be spreading the message of decreasing stigma and discrimination.
So what does the reaching out look like under this program? Dr. Guthrie?
the reach? That's a good question. I would like to say, I wonder if Donna can comment more on the reach. Well, we hope to reach as many as we can.
And this evening is a very good opportunity. I don't think I need to say that this is a very well listened to and respected program.
Of course.
So we're very happy to be here with you. You know, all your listeners in Jamaica and in the diaspora may have touched this topic in different ways. And in a sense, it's as if this is no longer a real topic. But the National Family Planning Board shared with us a couple of surveys in the last few years. And one of them showed that over 53% of people living with HIV and AIDS in a sample that was done felt guilt and fear and shame because of stigma and discrimination. Another 2017 survey showed that only just above 11% of us as Jamaicans accept people living with HIV. So to be able to use this platform or individual platforms, advertising campaigns, social media, opportunities to address different groups, like I'm hoping next week that we will address the JPs of St. Andrew. You know, there are 2,000 JPs in St. Andrew. If we even get a small percentage of that, these are influencers who would get a better understanding of the issue, be able to ask questions, and see how they too can be champions for change. Champions for justice, human rights, fairness, all the things we believe in.
But Donna Parchment Brown, haven't we come a long way in this campaign and a series of activities over the decades? And I can speak of decades.
Yes.
I remember when I was a young director of television and current affairs at the then JBC in the mid-1990s, early 1990s.
Right.
And we had a program which was hosted by Elaine Wint Leslie at the time, Tuesday Forum.
Yes.
And we decided to tackle the issue of HIV AIDS in Jamaica. Yes, we came
up. A lot of good work has been done. Absolutely.
Yes.
And a lot of progress made. But you know what tends to happen? Something gets out of vogue, out of fashion. It's not so much in the public eye. Yet there are people who are affected every day by that situation. And so it's time, we think, to bring this back on the front burner and say, look, progress has been made, but there is more work to be done. Because what people from accessing health care to the degree that they might need to, they might not go to the pharmacy for their drugs because people will know or hear. They may lose jobs, but it doesn't become a big public issue because they don't want the public shame of being fired for that reason.
We're still firing people, denying people employment on the basis of their HIV status. Donna?
That's my understanding, that when it's known, that is something people are concerned about, disclosing. You know, because they fear. Now, it could be that, you know, many employers might not be negative about it. But if I feel so stigmatized that I wouldn't even risk disclosing, as Demaria mentioned, that's a mental health issue, you know, and we don't want that. We do want to move closer to outer many one people. You're a Jamaican, by virtue of that, you have certain rights. You must be respected. You must be treated properly. We have to embrace one another.
Demaria?
Yes, one of the things that we must remember, according to popular culture, people's reaction sometimes, gets trained a certain way. I remember on the point of information about maybe 30 years ago, Magic Johnson, was one of the first super celebrities who came out and just opened up and said, like they said, he came out of the closet, so to speak, about being HIV positive. Now, I'm sure a lot of folks did not want to play ball at that point, but we live to see that he's still alive. We live to see that it's not caught topically by just leaning on someone. It's not spread by if someone speaks to you and like, you know, there's saliva drop on your hand and you'd become positive, you know, things like that, you know. And I get to even understand that there are some other more quite revealing non-spread facts, you know. So it in other words, what you're saying is give the HIV positive Jamaican a chance to live, to be, and to make to make good, you know, of the promise.
I would say that at the root of all of this, of course, education is at the root of it, and a lot of these things we think people remember that HIV is not transmitted in certain ways, but we always have to re-educate, because some people really don't know, and they still believe that HIV is transmitted in ways that it is not, and a lot of that creates a lot of the stigma.
And in terms of dealing with the public health aspects of this, Dr. Guthrie, what are the challenges there?
Well, truthfully, again, education is a huge challenge. People really just don't understand the disease itself and the disease process, and that largely is a problem. And culturally, we have some very specific stigma-related behaviors that are very Jamaican. So we have to tackle that, and we have to also get to the people. So we also hope in this campaign that we'll get to have many opportunities to educate on a large scale, either virtually or in person. So that definitely is one of the challenges.
Yeah.
I mean, over the last 3 years, Cliff, we saw healthcare workers rise to an amazing challenge, right? There was enough information out there. They could learn how to handle different situations dealing with COVID-19, a highly infectious disease that we did not know about before, that is still relatively new. And as you said, there's been a lot of information, research, and improvement in understanding and care of HIV, people living with it. And so, you know, we can embrace it in the same way. Put information out there. And people like you and us, the champions, people like Joan Stevens, a woman living with HIV for over 30 years, a beautiful, beautiful Jamaican woman, so smart, like many others who we don't necessarily know. We have to be that safe space in encouraging others and ourselves modeling the correct behavior towards everyone.
Right, and what a champion Joan has been, she has been unashamed to share, because she recognizes that sharing her journey and her story is more empowering than it is defeating the cause. So she shares willingly about her status and the challenges she has faced, and it has helped many.
So what next can we look forward to from the campaign? Any big thing, any event?
Well, I would say look out for us at some of the large popular events across Jamaica, because remember now, my sister Donna Parchment has a big footprint, I may say, or handprint in the justice arena. Mario, the same for medicine, and myself in entertainment. And talking about entertainment, I'm not sure if we have already sewn it up, but maybe we'll be in some reggae sunfest. Maybe we'll have a booth. Maybe we just have activators walking around talking about, maybe you see Donna Parchment.
Yes,
having a conversation with a minister of government, you know, or a visiting minister of government from another country. But the idea is to make this into popular culture, to stimulate and to re-educate and to put a spotlight on the passion that we have for lifting our brothers and our sisters who are challenged at this moment. Some of them scared of even going to the pharmacy for their medication. We want to do something to help them and put back that smile, that spark in their life and on their faces.
Cliff, I'm not sure if you've seen the campaigns as well, but the ad is currently running on local television. So we have a commercial that is basically showing someone who lost employment due to stigmatization, and it pushes people to be champions for change, and we have radio and TV commercials running currently.
Good. Well, thank you very much, Donna, DeMario, and Dr. Guthrie. Thank you all, and all the best. And we here at Nationwide are always willing to promote this kind of public campaign, for the national good.
We know you're a champion for change, Clay.
Thank you.
All right. Have a good evening.
Champion,
you too.
Diffuse and Nationwide.
Have a good evening. This is Nationwide at 5.